Hey y'all, it's Squash, and I'm just giving everyone an update on my top surgery stuff. So last time I said I was going to try to get insurance to cover it, so I got a doctor's letter and a therapist letter, and I sent those in, and my insurance came back and told me that they didn't cover it, which I kind of expected, so I'm paying out of pocket. So I had my consultation with Dr. Mosser in January, and my quote was about $10,500. I mentally have tacked on about $1,000 more just for like emergency sake, and they also told me that they couldn't quote what the pathology fees were going to be, and that would probably be around $600. So I just tacked on that extra $1,000 to cover like that and any other sort of like crazy expenses that are unexpected or whatever. So I had my consultation with Dr. Mosser, and he told me that I'm a little bit too big for the fish mouth incision procedure, so I'm going to get a double incision with free nipple grafts. He also told me that my scars would have to meet in the middle, which is a little bit disappointing, but I'll get over it. So I have a virtual pre-op with him in July, which is about, I think, 2 weeks before I go down to California for the actual surgery. And when I have that virtual pre-op appointment, I'll probably ask him if I can get the double incision surgery, but with scars like fish mouth. I have no idea what he'll say, but it doesn't hurt to ask, because the difference between DI and fish mouth is that double incision with free nipple grafts, they literally cut the nipple out off the stalk and place it, and they, and like, resize it, do whatever. Whereas with fish mouth, if I understand correctly, the nipple stays attached, and I don't really care about my nipples staying attached to anything. I just like the scarring style better. So, yeah, also since the surgery is like 6 whole months away, I'm using that to my benefit to get like in shape properly. So I've started earlier this past week. I've been working out every day, switching off. So one day I will do weight training, and the next day I'll run and lather, rinse, repeat. So for the consultation, Dr. Mosser and I talked on the phone. I didn't actually ask all the questions that I wanted to ask him, because it was kind of moving quickly, and also I figured it would be better to ask some of those questions during my virtual pre-op or the actual in-person pre-op. I asked if I could have my scars straighter as opposed to curved, and he said yes, but also told me that they might have to connect in the middle, or that they'll probably have to connect in the middle. I asked how long until I could get a tattoo on my chest, specifically on my scars, and I told him that I was planning on waiting at least a year, and he said that's a pretty good time frame. He also told me I'd have to wear a compression vest post-op for about 2 weeks, and that I'm allowed to drive as soon as I'm off the major pain meds, but my research on Reddit has told me that most people should wait a little bit longer, so I'm probably going to wait an extra week. Also, I have an intracranial shunt for hydrocephalus as an infant, which I mentioned first thing during the consultation, and Dr. Mosser has never operated on anybody with that type of shunt or like medical equipment or whatever, so he asked me to get in contact with a neurosurgeon in order to get clearance for surgery and or to get any information that he needs about doing surgery around that sort of medical equipment. So I did that. I got an appointment with a neurosurgeon who, looked at my head and went, oh yeah, you're good to go. And then I also got x-rays to bring in with me on a disc just in case, but also like I needed to update that anyway. And once I had all of that information faxed over, I scheduled my surgery. So my next step was to fill out FMLA forms for leave at work. I let my manager know that I had this surgery and I'm out at work, so she wasn't like super surprised or anything. We filled out an FMLA form together in her office, which was mostly me writing my name and checking boxes. But basically it included a description of my job and my duties and like all the things that I have to do, and then I had to decide how long I wanted to be off work. I decided I wanted to be off work, if possible, about 5 weeks, because there's a lot of heavy lifting in my job and a lot of like reaching up and pulling down and stuff like that. So I decided about 5 weeks. And then I had to decide, you know, what proportion I had to, or I wanted to use my vacation time that I had saved up versus my sick leave that I had saved up. So I did that, and I decided to use all but 1 week's worth of my sick time, just in case when I get back I, you know, have to take the day off or whatever because it's too much. So I filled all that out. My manager actually faxed it to Dr. Mosser, mostly because I don't have a fax machine at home. And Dr. Mosser's assistant will fill out the doctor's side of those papers and fax it to my work's HR, and then the people who are in charge of FMLA leave, or I guess leave in general at my HR, will decide how long I have to be off work for, based on the restrictions that Dr. Mosser gives me. And then once I'm healed enough to work, I need another letter from Dr. Mosser saying that I'm allowed to work fully again. I'm a little bit worried because he has this kind of ridiculous rule about not raising your elbows over your head for 6 whole months after you get surgery, which is crazy, and I've never heard of any other doctor having that. But I'm a little bit worried because I hope that the people who are in charge of leave don't see that and decide I can't work for 6 whole months, because I can afford like 5-ish weeks off work, but that's about it. Like, I could not afford 6 whole months of not working. And then the actual surgery, all that stuff. So I have a virtual pre-op, like I said, a couple of weeks before the actual surgery. That's just because I live in Washington as opposed to California. So I guess if you lived in California, you would have an in-person pre-op that amount of time before. So I have virtual pre-op in July, and then I have an in-person pre-op the day before my surgery. And then the 6 days post-op, I get my drains and bandages off. For the actual surgery, I'm planning on driving down about 3 days before the date. And then I'm going to stay with my parents, who live in the Bay Area, about 40 minutes from San Francisco. And they're the ones who are going to be taking care of me. I'll probably stay with them for like 2 or 3 weeks. Total. On like the 3rd week, I'll probably go hang out with some like California friends and stuff like that, once I'm, you know, up and moving a little bit more. And then after that, my parents are going to drive me back, just because I don't know if I wouldn't be able to drive that whole way from California to Washington all by myself, which is fine. My mother has decided to buy tickets to go see some plays in Ashland, Oregon, on the way up, so it all works out. And then I'm gonna go home and hang out with my friends and sleep in my own bed, and you know, sit around and like read books or play games on Steam or whatever for another couple of weeks until I can work again. And yeah, that's what's happening so far. I'm excited and a little nervous, and mostly very excited. And I will update probably again after the pre-op consultation in July, or maybe I'll do a like, here's what I've bought for all of my pre-op or post-op recovery stuff, because I'm planning on doing some sort of like shopping haul for all of that. It's closer to the surgery date. But yeah, that's all I have for now. Bye!